That's a very difficult question to answer because it supposes that we really understand the genetic causes of AMD, and we have implicated at least 70 genes in the wet AMD realm. That doesn't include the many other genes in the dry AMD realm. Those genes interact with other genes, the environment. I mean, it's just the complexity of genetics it baffles me. And the textbook that I had when I was in medical school, I'm not going to say it's obsolete, but it it really is a simple view of genetics as we have it today. So I think we do know that there is some genetic influence on the incidence of AMD. That's why we see differentials between racial groups. We know Caucasian patients and patients from China, Chinese patients, have a higher incidence of wet AMD. But we don't know, statistically speaking, if you have this gene, what is the percentage chance you will develop wet AMD in your lifetime? One thing that we do know is that the data may be biased a little bit by the fact that on average, Caucasians smoke more tobacco than Chinese patients, and more tobacco than African American patients or Hispanic patients. And that tobacco use as a behavioral confounder will increase the risk of wet AMD development significantly. So we can look at genetics from a statistical standpoint, but it's really, really hard to parse out the other environmental and behavioral impacts that there are on the development of wet AMD.